Thanks for joining us, Professor Enrico Coiera, who is here to talk about, I guess, your passion and your excitement around AI med and the healthcare industry in Australia and the evolution. I mean, you have been there along the journey. It's like a patient journey for AI med for many years. Do you feel as though this is something that's been coming to Australia we need it to happen now? Is it desperate, or is it a long way in the future?
Good question. So you're right, I've been in the world of AI and healthcare for 30 years, which makes me sound very old. I probably am. And it's also true that although we've had great technology for that period, there's been not much interest in adopting it. Maybe healthcare has not been ready, but now it seems to be the AI moment, certainly overseas. Everybody is not just talking about it and investing in it in industry, but they're deploying it in working systems. Australia, we are excited but slow to adapt, and so it's great to see the level of engagement now in this topic here. This is technology that on its own doesn't do much, but if we use it smartly, it's really going to be able to make a big difference to our healthcare system.
So it sounds as though integrating it into the patient journey and into the clinician's experience, that's the key, rather than the fear of maybe things taking over and removing that clinician from the experience?
Look, I think even the words artificial intelligence conjure up so many wild ideas in our heads.
Crazy robots.
Yeah, just think about it as smart programs that we can train that will do very specific jobs for us. It might help us read an X-ray, it help us decide who needs to be screened. It's not going to be the Terminator.
Absolutely.
That's a long, long way away, a couple of weeks before he comes.
Yes. So it's about using that clinician experience, and they're the decision makers, whereas the AI is almost like the background programming to help along the way.
It's the automation that helps it go along, and it's not just clinicians, it's consumers too. The big thing is we want to make a difference to the way care is delivered. We want to make patients have better outcomes, live longer, live better. We want to spend less money. We want to deal with the workforce shortages we've got. And so that's what automation lets us do. But it only works if we use it in the right way. And one of the big lessons for digital health is that the technology achieves nothing unless you have a real problem that needs to be solved, and for which the technology actually is the right answer.
Now, the AI Med that's coming in September, the summit, you're obviously going to be speaking there. What makes it different from other medical conferences that happen throughout the calendar year?
So AI Med, as the name suggests, is focused just on artificial intelligence in healthcare, and it's probably a new kid on the block. It's been around for 3 years in North America, and it's very interesting in the way it engages the audience. It's not your classic conference. It's a lot more interactive than that, and it's fun to see that come to Australia now, because I think the time is right here, and I like to say that AI Med has a little bit of Hollywood about it, and I
bit of rah-rah.
Yeah, and I don't mind that. I think that really makes it fun. So anyway, an important topic, a kind of a very important conference on the circuit, and it's about time it came here.
And the way it's delivered, do you feel it's more of a casual conversation, or is it very much the speaker and the learner?
So it's much more about very short presentations, sort of TED-like, and then quite a long time with conversation with the audience about what they've heard. So that's very different.
The interaction's quite important. Yeah. Fantastic. Well, look, thanks for joining us this morning. Good luck with your speaking. This room is going to be full, and it's going to be an exciting morning with lots of networking, collaboration, and the importance of AI in healthcare. Thanks for joining us today.
It's a pleasure. Bye-bye.